We lost Tommy on the last day of 2020. A bunch of different organizations started to name things after him. The Humane Society did, and Mercy for Animals did, and Blair High School, where he went to school, and Harvard Law School, where he was a student, is working on putting together a fellowship for him. But we were hearing about all of these things, and then I heard from State Senator Craig Zucker and Bonnie Cullison and Senator Augustine about what they wanted to do here in Annapolis as part of state mental and emotional health programming, to make this part of the 211 program so that people could call in for help, and then to sign up to have a counselor check in on them periodically, to call in to check on their health. And we were so moved and inspired by the idea. We said, of course, we would be honored to have you name it after Tommy, and that would be a beautiful and enduring legacy for him, to make Maryland a state where not only do people have somewhere to go if they're in crisis, but where the state then continues to reach out to you. Governor Hogan, I'm moved and honored that this was the first bill that you signed this year, and I'm moved to think that we have a state that has worked together across party lines, across every conceivable line, to focus on emotional and mental health. It's a crisis in the country. COVID-19 took a huge toll on our people. The mental and emotional health problems among very young kids, even preteen kids, have skyrocketed. Teenage mental and emotional health crisis has skyrocketed, and the rates of suicide and suicide attempts have gone up dramatically. So that's what this helps to respond to. We live in a state that cares about each and every young person out there, and we don't want to lose anybody else. And so my family is just really happy that Tommy is being honored in this way. And let's hope we get to a place where we don't lose anybody else. With that, I want to thank everybody involved. Mr. Askew, Quentin Askew, thank you so much for incorporating this into 211, and Bonnie Cullison, and Senator Zucker, Senator Augustine, and Governor Hogan. I'll turn it over to you.
Well, good morning, everybody. Thank you, Congressman. I just want to take a moment to thank you for your leadership on this issue, and for your willingness to channel your own grief in order to help address the mental health crisis in Maryland and across America. I know that countless lives will be saved because of the law that now bears your son's name. My heart and my prayers obviously went out to you and your family on your tragic loss. And when my family was talking about their experiences with discrimination against Asian Americans, you were the first person to reach out to me. And I thank you for your leadership on that issue as well. These are things that, as the Congressman said, they transcend partisan politics. And that's exactly what we see here today. The day after Sine Die, as the session ended, I was very proud to sign the Thomas Bloom Raskin Act into law as the very first bill for the year. I want to thank Senator Zucker, Senator Augustine, Delegate Cullison, and all of the legislators on both sides of the aisle and in both chambers who worked to pass this important bipartisan legislation. We aren't just memorializing Tommy's memory, we're also ensuring that his name will forever be a symbol of hope for others who are struggling with mental health issues. particularly after all we've been through over these past 16 months. It is critically important that we continue to focus on the issue of mental health. No one should ever feel like they must suffer in silence. So Congressman Raskin, thank you again for your leadership on this issue, and I look forward to continuing to work closely with you on this and other important issues. Thank you.
That's so wonderful. Thanks so much. So, should I bring you? Okay.
Well, good morning, everybody. I'm Senator Craig Zucker, the Senate sponsor of the Thomas Raskin Act. I want to, thank the governor of the state of Maryland for putting this as a priority for him and his administration. I want to thank Congressman Raskin for his partnership and his blessings and all of his advocacy to bring awareness to mental health. And I want to also thank my colleagues, Senator Augustine and Delegate Cullison, as well as Quinton Askew for their leadership on this. I believe what you heard already today is that when it comes to helping those that might be suffering or afflicted with different with mental health, that it knows no political party. That this is an opportunity to put Marylanders first and focus on what is needed most. And this has been a year like no other. And we've seen the physical toll that COVID has taken on people's health, but often there's this invisible toll when it comes to how it's impacted people's mental health. So I remember the evening that we lost Tommy Raskin, and it shook my family to the core. And I remember looking at my wife saying, we've got to do something. We've got to help people. And then shortly after that, I got on the phone with Delegate Cullison and Senator Augustine, and I said, hey, what about doing this mental health check-in where we can have people proactively schedule appointments, and 211 would reach out to them to check in on their mental health. And one of the things that's important about this is it gets people before they're in crisis. It gives them the opportunity to talk to a mental health professional during the time where they need assistance the most. Again, this is an opportunity to help thousands of Marylanders and also save lives. And I know that on July 1st, when this bill becomes effective and this 211 is up and running, the Tommy Raskin name will continue to build and create a brighter and more hopeful world. And with that, it's my great pleasure to introduce one of my colleagues, really the go-to person on the Senate Finance Committee, who helped steer this through the Senate Finance Committee with the support of President Ferguson and Chair Kelly. But that's my good friend, Senator Malcolm Augustine.
Thanks, Craig. Appreciate that. Thank you, Craig. Congressman Raskin, it's a tremendous honor to be here with you, and we feel you for the loss. But your bravery and your honesty and what you shared and what you wrote really touched us all, and we thank you for that. You know, it's just really tremendous bravery, and we really do feel for you and your loss and in this very difficult time. We're really grateful for you for that. And Governor Hogan, thank you so much for just, understanding this is something that touches us all, and that it is a priority. And I'm grateful that you did see fit to sign this as the first piece of law this year for our session. This really is, and of course, Delegate Cullison is our go-to person in the House of Delegates, and that's why Craig called her first, of course, which he did. And I know that's the case. She is the go-to person on this, and it's been good to work with Mr. Askew at 211. But this really is the brainchild of Senator Craig Zucker. Craig Zucker called me and said what he just told you. We have to do something about this, Malcolm. And Craig came up with the idea of taking our senior call check program, which is an outgoing program for seniors that is actually renowned in the country. It's one of the very few places in the country that has this outgoing program to call our seniors, to senior call check-in. And he said, well, let's match our senior call check-in program with our, again, best in class in the country 211 system that has this connection with the behavioral health services. What an idea. I mean, it really was a wonderful idea, thought concept. He came to me I said, that's a great idea. We talked with the Mental Health Association of Maryland, the National Alliance for Mental Illness, who are my partners in working on behavioral health matters in the state of Maryland. And we brought those groups together and came up with this just outstanding program that I'm so excited to see save lives of many Marylanders. And as I said, the person who also, from a legislative standpoint, brought this stuff together, who is my go-to person in the House of Delegates, is Delegate Cullison, and I really am pleased to bring her to the stage. Thank you.
Thank you, Senator Augustine and Senator Zucker, Governor, for allowing me to be a part of this incredible legislation. You know, in Montgomery County, when somebody says Jamie, most of the time we know who we're talking about. Congressman Raskin is much more than a political figure in Montgomery County. He's our neighbor, our colleague, our friend. So when we learned that he lost his son in December, as a community, we were devastated and we grieved with him. But we were in shock when we learned that it was due to suicide. A loss like that is one of the most difficult challenges a person can face. Losing someone to suicide is different from other causes. The survivors are often left wondering, what could they have done to prevent this? As a legislature, we are being asked constantly, what can you do to help Marylanders who suffer from mental health and substance abuse disorders? And we've answered with some programs. We have crisis hotlines that people can call when they get to that crisis point. But with this law, 211 Maryland and the Maryland Department of Health, their partnership is creating a program that proactively attempts to prevent getting to that crisis position. In the 211 Maryland annual report, they show us that since 2013, the number of people calling who are at that crisis moment has increased by 700%. In 8 years, 700%. And that is not due to COVID. While there was a little bump because of COVID, it was increasing at that rate before COVID hit. By providing individuals with the opportunity to volunteer for these check-in calls, they're actively helping themselves. If during the call the individual isn't showing any signs of being at that point or any concerns, then it's just a friendly call. If the person is showing any signs of being in crisis, they can get immediate help from the professionals at the call center. I think Tommy would approve of this program. Jamie and Sarah have told us that in his final communication to them, he asked them to please look out for each other, look out for the animals, and the global poor. I think this program fits that legacy well. I want to thank again my partners in this program, and now I want to say thank you to you for being here today to spread the awareness about this program, because that's what will make it work for people. Let them know that it exists. And now I want to bring to the podium the guy who's actually going to make it happen, who's going to be the person on the ground that is going to put this program together. That's the president and CEO of 211 Maryland, Quentin Askew. Thank you.
Hello. Good morning, everyone. Good morning. Just like to say thank you, Governor Hogan, for signing this bill into law. Thank you, Congressman Raskin, for sharing your story and really shining a light on mental health. It's definitely appreciated. I want to thank Senator Zucker, Senator Augustine, and Delegate Cullison for their leadership in bringing mental health to light and providing us an opportunity to provide this particular services to Marylanders. At 211 Maryland, we're really excited to be a partner in this effort in order to provide proactive mental health services for those who are in need. As we are ending Men's Mental Health Week, we really encourage anyone who is in need currently, who really needs to talk to someone who may be in crisis now, to utilize our 211 Press 1 crisis line. But we also just want to ensure you that for those who are in need, as well as need proactive services, that this particular bill will provide something for you. A caring person on the other end of the line to help you whenever it's needed, someone to check in. And so we are encouraged and we are excited to begin this program in July, and we're really looking forward to getting it started. And so for anyone who has an interest and just want to keep updated to when this program will start and to sign up early, you can do that by texting Health Check to 211-MD1. Just text Health Check to 211-MD1. You'll stay updated. You'll get alerts to when the program is active, but you'll also be able to stay engaged with us at 211 Maryland. Thank you.
Well, thanks to everybody for making this possible and participating. I was thinking about how Tommy used to say, it's hard to be human. And this legislation makes it a little bit easier to be human in the state of Maryland because it lets all of our people know that the state is listening and we're willing to invest the resources to help take care of people. Tommy was a graduate of all of the very fine public schools in our area in Montgomery County. He went to Tacoma Park Elementary School, Piney Branch Elementary School. He went to Eastern Middle School. He went to Pinecrest Elementary School. He went to Blair High School. I think that all of us are proud that his name will be associated with this program that will be there for young people who may be in crisis. It's definitely been a tough time for young people, and as Delegate Collison said, it didn't start with COVID-19. But it certainly got worse during COVID-19 because of the sense of isolation that so many people experienced, and young people could not get on with their educational careers and their professional careers, and a lot of them, were forced back home and had a difficult time with their relationships and so on. So it's been a tough time for people, and I'm glad we're coming out of it. I hope everybody will get vaccinated if you haven't already. It's really important. There's a big difference, Governor, between the states where we've been invested in vaccination, like Maryland, and the states that have not been, where there's still, there's still an accelerating spread of the disease. But in any event, the floor is open for questions for the senators, Governor Hogan, for Quentin, for Delegate Collison, if there are any questions, or I'm happy to take any too. Yes. Yes. Well, I love that. I mean, I love our 211 program, and we need to make it more famous even than it is. Everybody needs to know that 211 is there for mental and emotional health. It does require people to take that first step to make the call, then to get on the list. But once you're on the list, then we will be reaching out to you as a state. That's a beautiful, wonderful thing. But I hope we live in an age where people recognize there's no stigma associated with mental and emotional health problems any more than there should be a stigma associated with physical health problems. I mean, I think a majority of young people now in the country have reported mental or emotional health difficulties through this period. So we've got to get over the idea that there's any kind of stigma or shame connected to it. We just need people to get healthy. We don't want to lose one more person to the trauma of suicide. Yes, please.
Are family members and friends allowed to sign up loved ones?
Absolutely, yes.
Do you want to
Absolutely, yes. And so the program is offered for anyone, family members, friends, anyone who might be in need, anyone who just needs encouragement or to speak to someone. It's available for anyone.
All right. Hi.
So I can answer that. So this will be a holistic effort, and so we will be working with our 988 partners, our 211 Press 1 Crisis Center, along with our proactive services. And so our proactive services with the Raskin phone call program will allow us to identify someone who's calling that may not be in crisis immediately, but if we identify they are in crisis, then we can really direct them and connect them with the appropriate services. So I think this would be that initial stop to really help support initially before the crisis begins, to be proactive, but when the crisis comes, we can really connect them with a whole holistic services of programs. Thank you.
Those counselors on the other side of the line, what are their commitments? Who are supposed to?
So our great network of call centers, these are call centers that are accredited, they are certified, so they have training in the American Association of Suicidology. Some have master's and bachelor's level degree in human services. So these are individuals who are trained or who are accredited, who have been providing services for over 20 and 30 years. So these are individuals who have the background and the expertise and the empathetic listening skills to be able to provide that support.
Sorry for my late arrival. Possibly you can actually tell us about the points of signing that this bill.
Well, first of all, let me just again thank everybody that really did all of the hard work to make this happen. I think it's an incredible program. Simply because there was tremendous support. These leaders here really did the heavy lifting and pushed it through the legislature, but it had support of nearly everyone, and it was such an important issue. Number one, I liked the idea that we were honoring Congressman Raskin's son in this way. And number two, I thought it was a critically important bill to sign. And that's why we decided, we have hundreds of bills to sign, but this one rose to the top as the one. Symbolically, I wanted to make it the first one, and I signed it into law and gave the pen to Congressman Raskin, who couldn't be with us that day, but we saved it for him so he can keep that memory of signing the legislation into law.
Yeah. Yes, that's a great question. So once someone signs up, they'll be able to speak with a call center specialist, crisis specialist, to identify what their need is. Once their identified need is, they'll be able to schedule weekly appointments, weekly check-ins with a crisis specialist. If they need that every other day check-in, they'll be able to schedule that. So it'll really be based on the need of the individual, how often they choose to contact. And so that contact could be done by phone, text, or chat. And once they are contacted, we will connect them with a variety of services that they might need. If it's more than I just need to talk to someone, but I want to connect with the services in my community. So we'll connect them with the resource in their community. So it's really based on empowering the individual to help us to understand what their needs are so that we can provide the appropriate services. And so we'll be a listening ear to identify what we can do, but it will be based upon what the needs are of the individual. No, so law enforcement is involved if it's a medical emergency situation, if the person is in danger or endangering others. And so our crisis specialists are trained to understand that. We are connected with mobile crisis teams locally. We have a great relationship with our local law enforcement. And so if it is identified through the call that there is some crisis or there is some immediate need, then that they are connected with that particular emergency service.
Say somebody does sign up and then they end up not taking any of the phone calls. What action are they taking?
Yes, so there will be some follow-up, some checking in. So if someone does sign up but they may disengage, there will still be some automatic check-ins. And so that check-in will be by text. It'll also be by phone to really understand what the need is. We'll also have a backup person in the family. So we'll ask the individual, who should we call if you may not be available or if you don't answer, so that there's a trusted person that we can verify that this individual is okay. So it's going to be a statewide initiative through all of our crisis centers. So currently there are 5 crisis centers that we have supporting our line throughout the state. So there are, more than hundreds of crisis specialists that will be available throughout the state to help support the initiative.
Thank you very much.
Thank you all for coming. And thank you again, Governor Hogan. Senator Zucker, Senator Augustine.
Thank you. Thanks,
Delegate
everybody.
Hall.
Appreciate it.
Thank you.
Thanks for your good words.
Delegate, thank you for your hard work.
Thank you, Governor.